Michigan is just weeks away from enacting cost controls on medical care for crash victims, and critics continue to sound the alarm that this effort to lower insurance costs will cause long-term care facilities to close, forcing patients into nursing homes.
The new rules begin next month and will require rehab clinics and other medical care providers who treat crash victims paying with no-fault insurance to cut some of their prices by nearly half.
As TV5's Rachel McCrary reports, some crash victims are already being informed that their care will be ending once the changes take place.
Brian Woodward fears for the future. In just a few weeks, Michigan's auto insurance law will be drastically different.
My options are going to be pretty slim.
Woodward is a crash survivor. He was thrown from a vehicle in 1983 and has been quadriplegic ever since. Through the challenges, Woodward says he was still able to get the support he needed to be successful thanks to Michigan's auto insurance system. After the crash, he went to college and works as a contract employee in computers with the Big Three. He thanks Michigan's catastrophic insurance coverage for being able to thrive.
It took away a lot of the financial burden.
For decades, Michigan has required drivers to pay the highest level of personal injury protection, or PIP coverage, in the event of a crash. But come July 1st, insurance is changing. Some say the new law has flaws that need to be addressed, like reducing the amount insurance will pay out to providers. Right now, that will be a reduction of 45%, causing many facilities to cut care.
That's why I'm trying to do a legislative fix.
State Rep Ryan Berman brought up a bill on Thursday that sets to use previous prices to determine reimbursement, adding that the law lumps in healthcare providers that previously charged reasonable prices with providers that overcharged. House Bill 4992 would also make it so a provider could not charge more than the average price. If the bill passes, it would no longer have a huge impact on providers that were charging fair rates, according to Berman. He adds that would also keep them up and running.
And it's a situation like this, and you have a concrete deadline. I think that gives it a lot more legs and a lot more ability to have swift movement.
Woodward owns his own home, and he says his care workers are like his family, and he's hoping he isn't forced into a facility.
Hoping, that will go through.
In Genesee County, Rachel McCrary, WNEM TV5.